Good afternoon or good morning, Dr. Monaco. I don't know what time you're watching this, but my name is Janai Collins, and today I'm going to be doing my presentation on the human immunodeficiency virus. Go to the next slide. All right, what is HIV? HIV is a human immunodeficiency virus, and it's a current global public health issue. And it attacks our body's white blood cells, and these white blood cells are also known as our CD4 T helper cells. When these cells are destroyed, the body's immune system is weakened, which makes it really hard for our body to fight back against infection. Our anatomy. So HIV is very microscopic. It's measuring in about 100 nanometers in diameter, and a host cell and CD4 receptor must be present in our body to copy our genetic information and material, and it must also have permission to enter the cell. The outermost layer is going to be our lipid envelope. And this lipid envelope is made from phospholipids and cholesterol. So we're going to move on onto the lipid envelope and what's inside of it. So what's inside is going to be our glycoproteins. We have GP120 and GP41. And so GP120 is the first to bind to the CD4 receptor on a host cell. And GP41 facilitates fusion of the viral envelope with the host cell membrane. So next, we're going to have our matrix layer, which lies directly beneath the envelope, and it houses our protein P17. And P17 helps to form part of the structural scaffold of HIV. And it also helps hold and support the protein to the rest of the virus, since the lipid proteins aren't strong enough to support it alone. Next, we have our capsid. Right here on the left, I have a visual image of what it looks like. And the capsid protein is made of P24 and is shaped like a capsule. Its primary job is to protect HIV's genetic material by surrounding the linear single-stranded RNA genome and enzymes that are associated with it as well. This is very viral in detecting HIV. I do have a quote, and pathology tests explained prove that the P24 test identifies actual HIV virus particles in our blood. So moving on, we do have three very important enzymes that help with replication in HIV, which is going to be our reverse transcriptase, our integrase enzymes, and our protease enzymes as well. So the reverse transcriptase is the process by which HIV converts its single-stranded RNA genome to double-stranded DNA. It also creates a complementary DNA strand after another DNA strand is created that forms a DNA double helix. Our integrase enzymes binds to viral DNA, and the virus DNA inserts the cell's DNA. And lastly, we have our protease enzymes, and this breaks down large proteins into individual functional proteins, such as amino acids or peptides. So there are a few systems that are affected. The main system is going to be our immune system, since we do know that that this disease does affect our CD4 T helper cells. So depending on the stage of the virus, the nervous system can be affected as well. If this virus reaches our brain or our nerves, it can cause other serious conditions such as lymphomas, neuropathy, or fungal parasitic infections. Any conditions that I did list after the nervous system, it can be affected. And neuropathy is the most common. Neuropathy is a form of nerve damage that can cause pain, numbness, tingling, or muscle weakness. And then we do have other systems that can be affected, such as our gastrointestinal, our cardiovascular, or our inguinary. I'm so sorry if I'm pronouncing that wrong. I don't know how to pronounce it, but I know that is our system dealing with our skin. So now we're going to move on to our stages of HIV. There's three of them. So you have the acute, the chronic, and AIDS. So first, in the acute The chances of spreading this infection to another person is extremely high just because our levels of HIV is so high in bodily fluids at that time. This stage does occur 2 to 4 weeks after being exposed. And we do have common symptoms. I do have a picture over here on the left, which shows you. We have fevers, chills, headaches, night sweats, mouth ulcers, and so on. It's also very important to know that everyone's body is different. So some people may experience these symptoms, and some people may be asymptomatic and don't experience any symptoms at all, but they still carry this disease. So next, we're going to move on to our chronic stage. So this really slows down our multiplication rate, and the virus continues to multiply in our blood, but at a much lower level than in the acute HIV infection. So this stage can last from years to decades, and if left untreated, long-term damage will occur and it can become very detrimental and also lead to AIDS, which is going to be our next stage. AIDS is an acquired immunodeficiency syndrome, and at this point, our body's immune system is severely damaged. The normal CD4 count range is 500 through 1500 cells, and CD4 cells of somebody with HIV does drop below 200. So we do have common symptoms during this stage, which is going to be a persistent fever, rapid weight loss, swollen lymph nodes, sweat, chills, weakness, constant fatigue, chronic diarrhea, and also rash and bumps. So right here, I do have a picture of what it looks like if somebody was to have HIV and they don't get it treated. So before, you had see nice and healthy white blood cells, and then right here, once you get to the acute, you do have more and more and more, and then once you get to AIDS, it's just, severely damaged and weakened our immune system. So who gets HIV and how? Anyone can contract HIV. It doesn't matter your age, your race, it doesn't matter your gender, anyone can get it. HIV is spread through bodily fluids such as semen, vaginal fluids, rectal fluids, breast milk, blood, and pre-seminal fluids. It cannot be spread through sweat or casual contact, such as hugging somebody or sitting on the toilet seat. It can't be spread that way. If a mother doesn't get treated before her baby is born, she is risking the chance of passing the virus down to her baby, but it is the rate of passing it down is very low. It's less than 1%, but it can increase the risk of the baby having health issues or immune system issues or developmental issues as well. There are a couple ways to prevent HIV. Always use protection. That's very important. So use condoms so that you're not having direct contact with these fluids. You can also use PrEP, which is a medication that reduces your chance of getting HIV. It also works to block the HIV life cycle and preventing the virus from taking hold or spreading. You can also not have sexual intercourse at all. That's like the main way to know that you don't have the virus is to not have sex at all. You want to make sure that you and your partner are getting tested frequently. Don't share any needles or syringes. You can also use antiretroviral therapy, and this is more common in people who are negative and don't have the disease yet. And then you also want to be more educated on HIV, so you know like the symptoms, what causes it, how you can get it, just things of that nature. So now we're going to move on to our solutions. Currently, researchers are working on a cure. So right now there is no cure for HIV, but there are effective treatments to help prevent HIV from progressing to AIDS. Like I just mentioned our antiretroviral therapies reduces the level of HIV to help the immune system stay healthy. It's a combination of medications, and these medications can be taken by mouth, like as in a pill, as prescribed by your doctor, or it can be used through injection. And you want to take it once every 1 to 2 months. Common side effects of ART is going to be nausea, fatigue, diarrhea, vomiting, headache, and rash. All right, and we also have other medications that help um, the virus from replicating, and that's going to be integrase inhibitors, nucleoside reverse transcriptase inhibitors, and protease inhibitors. All those drugs should be taken. All right, so lifespan and life choices. Um, so with that, every person is different. So some people who are HIV negative and people that are HIV positive can have the same lifespan. It just depends on a couple factors such as treatment access, CD4 count, their current health conditions, genetics, and lifestyle. It's very beneficial to have a healthy lifestyle, stay educated, take ART medications, and attend regular, doctor visits. Other important lifestyle changes that are beneficial are to exercise regularly, maintain a healthy diet, don't smoke, limit stress, try to keep your stress at a minimum, get a good night sleep, and you also want to avoid recreational drugs and drink responsibly. So I do have some additional information here. So HIV has been around since the 1920s. The first sample of HIV-1 was found in a man in West Central Africa. People with HIV should start taking HIV medicine right away, just so that it won't progress onto AIDS, because AIDS is very detrimental to the body and is very deadly. A lot of people, I won't say a lot, but people have died from this disease. Um, HIV cannot be spread through mosquitoes, sweats, tears, pools, or casual contact, such as hugging. HIV is the virus that leads to AIDS. And in 2025, there was approximately 1.25 million people who are HIV positive. And HIV affects Black people, African Americans the most. In conclusion, I do want to say that HIV is a fast acting virus that attacks the body's immune system. A cure currently does not exist yet, but there are specific lifestyle changes and medications to help manage this virus. Making these lifestyle changes are very important because they can strengthen the immune system, making it easier to fight back against HIV. And people living with HIV can live a long, healthy life just like a HIV negative individual. Here are my references that I did use in my presentation. And I want to say thank you so much for watching. Thank you so much for reading my paper. I hope you learned as much as I learned, because I didn't know that much about HIV before I did this research project. And I hope you have an amazing day. Thank you so much, Dr. Monaco. And once again, my name is Janiyah Collins. Have a good one.